Abdominal aorta in front of, then the fourth and the fifth lumbar vertebra divides into two iliac common arteries. My dear, next time I will not give you the some time for the repeating. I will ask you about last material, which do you see I asked you today, about today's material, and about new material, which you will prepare for next time. Because you want to be doctor, you will not be worker for the working, do you see, in the garden or something on the street. Listen to me. Aorta in front of the border or between fourth and fifth lumbar vertebra divides into two iliac common arteries. Each iliac common artery in front of the sacroiliac joint divides into the iliac external and iliac internal artery, on left side and on right side. Iliac external artery, it gives two branches only. Circumflex iliac deep, arteria circumflexa iliaca profunda, which goes to the iliac fossa for the blood supply of the iliac muscle and periosteum of the iliac bone. Another artery goes, do you see, to the anterior, here it is cut, it goes, do you see, to the umbo, do you see, to the umbus, by posterior side of the anterior abdominal wall. And here it is covered by serous membrane, here it is covered by serous membrane, and this serous membrane, if it covers epigastric inferior artery, this is its name, and opposite along of it directs epigastric inferior vein. And when the serous membrane peritoneum covers it, do you see prominence and thus lateral umbilical fold. Inside of this lateral umbilical fold is placed the epigastric inferior artery and vein. Epigastric inferior artery, which is branch of the iliac external, it comes to the umba and anastomosis with epigastric superior artery. Who remembers what is epigastric superior artery? Where we took epigastric superior artery? My dear, you prepared this material for last control, because epigastric superior artery, this is continuation of the thoracic internal, which is branch of the subclavian artery. Subclavian artery gave thoracic internal, and its visit below than the diaphragm is called epigastric superior. Epigastric superior and epigastric inferior arteries, they supply the anterior abdominal wall. Before visit of the epigastric inferior artery to the anterior abdominal wall, it gives to the pubic symphysis the pubic branch. Epigastric inferior artery, before its continuation to the umba, it gives pubic branch. This is whole iliac external artery. When it will pass through the vascular raccoon vascular space below, it will change name. Below than the inguinal ligament, it will have name femoral artery. External iliac artery gave epigastric inferior and gave the circumflex iliac deep, and continuation of the iliac external artery below is called femoral artery. Another branch, this is iliac internal artery. Iliac internal artery gives, do you see, this, I will take, this is posterior trunk, and some branches, they are cut, the all branches are cut, and this will be anterior trunk. This is anterior trunk, and here is cut posterior trunk. Posterior trunk gives only parietal branches. What parietal branches supply? What parietal branches supply? No, everywhere. What they supply? Why they are called parietal? What they supply? Walls. And walls are formed by muscles, by bones, do you see? Because, do you see, one artery will go, do you see, behind of the psoas major muscle, do you see, deeply behind of the psoas major muscle, this is psoas minor separated from it, and comes to the iliac fossa. It supplies iliac muscle, psoas major, psoas minor, and it comes into the iliac fossa for the meeting with circumflex iliac deep from iliac external system. Iliolumbar artery. Iliolumbar artery, what is it? Arteria iliolumbalis. Psoas muscle is translated lumbar. Because iliolumbar, it supplies psoas major, iliac muscle, do you see, and anastomosis with arteria circumflex iliaca profunda. Another artery from posterior trunk, do you see, directs to the center of the posterior wall of the pelvic box. It is cut here. I showed you. Do you see? Here you can see. Do you see? Here you can see many. Do you see branches? Do you see? No, here branches. Do you see? They are cut. Do you see? And one we directed laterally. Another. They come from lateral to the center of the posterior wall of the pelvic box. It will be in front of posterior wall, will be in front of then the sacrum. And this artery, if it comes from laterally, it is called the sacral lateral. Sacral lateral from right side, sacral lateral from left side, and sacral median from abdominal aorta, they will do anastomosis. This anastomosis is very important because recollect me, please, what organs are placed in the pelvic box? What organs are placed in the pelvic box?
Reproductive organs and
What?
reproductive organs.
Testes в тазу. My dear, I will help you by operation. Because if the testis in the pelvic box, do you see, we do operation and we do descending of the testis into the scrotum. Scrotum is below than the pelvic box. Doctor and man, you don't know where is your testis. This is not laughing, this is crying. This is, do you see, student of the second year before exams. This is man, and he wants to be doctor. If the testis doesn't exit through the fetal life into the scrotum, doctor does operation, because the problem is called cryptarchism. It can be total cryptarchism on both sides. It can be monocryptarchism on one side. And about this I explained you when we studied the reproductive system, when we studied inguinal canal through which testis specially directs into the scrotum. My dear, who knows what organs do you are placed in the pelvic box? About what I speak with you if you don't know what is it in the pelvic box? In female organism, uterus, rectum, and urinary bladder. In male organism will be also seminal vesicles and prostate gland. Listen to me, in male organism will be rectum and urinary bladder, with, do you see, helping its objects which join to it. Do you see? And in female will be rectum, uterus, and urinary bladder. From back to in front of a rectum, do you see, uterus and urinary bladder. In male, rectum, urinary bladder. Inform me, please, in what parts rectum divides? What parts we can differentiate on the rectum? Superior, medial, inferior. Okay, but what are names of them? Inform me, please, what is function of the rectum? Storing of the feces. Storing of the feces. And for the storing, it must have the some region. What is name of it? My dear, in 2 months will be exam. In 2 months later will be exam. supraampular, ampule,
Oh, ample.
and subampular region. Because ampule is for the storing of the feces. Sometimes this portion of the feces can be very big, and the rectum will expand very large, and it is placed in front of then the sacrum. And by its expanding condition, it can press the arteries because the blood comes from right, from left, and from upper, and produces sacral arterial plexus behind of the rectum. You can see this will be sacral lateral artery, which anastomosis with opposite sacral lateral and with sacral medial. Another branch, look please here, another branch, will go by suprapiriform opening. Tavia, show me the suprapiriform opening. My dear, you patient died, my dear. We do this explanation of the lower limb. She showed me the upper limb. Patient will have
Oh my God.
what in my dear, do you see how the doctor must have attention? How I ask you about the lower limb, you ask show me the upper limb. You and you can't. What?
No, I'm just saying it's the lower limb.
She will not understand without you.
She's still searching.
Show me suprapiriform opening. They're not laughing. This is suprapiriform opening. From pelvic box, from posterior trunk of the iliac internal artery, by suprapiriform opening. Show how it exists to the back. My dear, you show me opening or what you show me? What in it? Okay. Okay. My dear, you must answer concretely on question. You must show concretely the element which I ask you. It exists by suprapiriform opening to the back. The another branch, it is called gluteal superior artery. Gluteal superior artery, it supplies the piriform muscle because it goes out near it. It comes to the back and supplies gluteus medial and gluteus minor muscle. Posterior trunk of the iliac internal artery gave iliolumbar artery, sacral lateral artery, and gluteus superior. Anterior trunk, look please here. This will be anterior trunk. This will be anterior trunk. Anterior trunk gives branch. Do you see? It hangs above the pelvic box, on the right side and on left side. And it goes by internal side of the anterior wall to the umba. And it is covered by fold, which is called the medial umbilical fold. But this artery, it was completed into the umbilical duct, which connected the fetus with mother, with placenta of the mother. When we got newborn, we cutted out umbilical duct. And this umbilical artery, by this distance, where it is placed behind of the umbilical fold, it obliterates, it closes its space and changes its name. This will be umbilical ligament. When it hangs above the pelvic box, it has space, and the space consists the blood, especially for the beginning from umbilical artery. For the beginning from umbilical artery, I don't see. It is called vesical superior artery. Vesical superior artery. From right umbilical, from left umbilical, they will come to the urinary bladder. Next artery, which begins here, it will go, do you see, to the below, do you see, to the back of the urinary bladder and below, and will supply urinary bladder, prostate gland, seminal vesicles. This will be vesical inferior artery. Vesical inferior right and left, which do you see began from iliac internal artery, do you see concretely? They will anastomosis with vesical superior arteries, which began from umbilical artery. Urinary bladder, it is for the storing of the urine, and it is for the expelling by storing. And because, do you see, it has very best blood supply. It is supplied by how many arteries? Urinary bladder. How many arteries supply urinary bladder? After your lesson, I will go into the hospital for treatment of my heart. My dear, vesical superior right, left, vesical inferior right, left. About what I explain you? About what you said? Why you cannot connect? Do you see my explanation? How many arteries? 4. For what I explain, I don't know. This is vesical inferior artery. You can see iliac internal artery is crossed, do you see, by ureter. And by short distance, when the ureter crosses the iliac internal artery, it gets ureterice artery, arteria ureterice. Also, here do you see from inguinal canal comes and do you see directs, do you see, to the region of the prostate gland, the deferent duct. It also joins to the iliac internal artery and gives ductus deferentis artery. Also, this artery gave the rectal medial artery. Rectal medial artery. Rectal medial artery will come to the ampullar part of the rectum, arteria rectalis media. Another branch, do you see this branch? Now I will take it. Where is it? Some minutes ago this branch, do you see? Do you see this branch? Look please here. Do you see this soft gray color? This is nerve. It goes to the obturator open. It's called obturator nerve. I will go together with it and I will take artery which travels near the it. Do you see? This is cutting of this artery. Do you see? This is obturator artery. This is, do you see? And here is continuation. Do you see? It comes to the obturator opening. Show obturator opening on the skeleton. Raunak, behind of you skeleton, show me obturator opening. Foramen obturatorium. Slava Bogu. Oh my God, okay. This is obturator open. From internal border of the obturator open begins obturator internal opening, obturator internal muscle. From external, obturator external muscle. If this artery comes here, do you see, it supplies this muscle, do you see, and it exits outside. It will give muscular branches for the adduction or medial group of the thigh, because this will be gracilis, adductor major, adductor longus, adductor brevis, and pectineus muscle. And it will give acetabular branch, which will go into the acetabular, and from acetabular branch inside into the head of the femur will go arteria capitis femoris. You can see this will be arteria obturator artery, it is parietal branch. Another branches, you can see, another branches, they, do you see, last branches, this, do you see the last branches, 2 branches, and they go together. They exit from pelvic box by infrapiriform opening. Show me infrapiriform opening. show me infrapiriform. My dear, don't wash something. Look here. Take the forceps and show me infrapiriform opening. This is infrapiriform opening. Show me lesser ischiatic opening. My dear, for whom you show? You closed by your hand. I don't see what you showed. This is sacrospinal ligament. Here piriform muscle. Here will be suprapiriform opening. Here between sacrospinal and piriform muscle will be infraspinal. Here will be sacrotuberal ligament. Between sacrospinal and sacrotuberal will be lesser ischiatic opening. By, do you see, infrapiriform opening, do you see from here, exit gluteus major, gluteus inferior artery. Here it exits, do you see, gluteus inferior artery, and it supplies gluteus major muscle. And together with it, do you see, here do you see exits to the back, here exits. And do you see, rotates around of the sacrospinal ligament, and by lesser ischiatic opening comes into the pelvic box, pudental internal artery. Pudental internal artery, when it came into the pelvic box, it gives rectal inferior artery, which together with rectal medial from iliac internal, together with rectal superior from mesenteric inferior, they do rectal plexus. You know for what? Because it is storehouse for the feces, can expand. Another branch of the pudental internal will go to the floor of the pelvic box, which is formed by muscles and fascias. This is called perineum, and because artery is called perineal artery. And from perineal artery, continuation will go to the dorsal side of the penis, and by back of the penis will continue along of its distance, is called dorsalis penis, arteria dorsalis penis. In female, it is very, very short, near the 1 centimeter, maybe lesser. This is dorsalis clitoris. You can see, if this is female organism, the iliac internal artery gives uterine artery, arteria uterina. From arteria uterina will begin the superior vaginal artery and ovary artery. And in the female organism will not be arteria ductus deferens. You can see anterior trunk, it gave umbilical, from which begins vesical superior, vesical inferior artery, rectal medial artery, obturator artery, arteria ductus deferens, arteria ureterici. It gives the gluteal inferior, it gives the pudental internal, with its subdivision to the rectal inferior, perineal, and dorsalis penis. In female organism, uterine artery. That's all.